health and medicine.
Dentists say they know their patients dread coming to see them. Maybe it's the Novocaine shots, maybe it's the sound of that drill.
Or both,
yeah.
And other things. But new technology could take a bite out of our fear of the dental chair. Fox 5's Beth Galvin joins us now with a story that might have needle-weary patients smiling again.
Well, Russ and Lisa, most of us know that a trip to the dentist is going to involve pain. Maybe it's a jab, maybe it's that awful ache, but pain nevertheless. So, is it possible to make it through an hour in the dental chair with no discomfort at all? A couple of Atlanta dentists say yes, thanks to some technology that's taking the bite out of pain. When it comes to opening wide and saying ah.
Pain. I have a low tolerance for pain, and I do not like the drill, the sound of the drill. I'm just sure it's going to hurt.
I guess my biggest fear is probably pain.
A lot of us aren't smiling.
I don't mind the needles, I just mind that the needles don't work.
Can you yawn?
If you've been dreading your annual checkup, welcome to the world of pain-free dentistry, and it all starts with a patch.
And it has Novocaine or anesthetic on the patch.
Stuck to the roof of Robin Gurin's mouth like a Band-Aid, the patch numbs the injection site. But wait, it's not what you think. Dr. Maurice Salama has replaced the dreaded stick with something called the wand. It's a computerized anesthetic injection system with a tiny prick and no awful ache.
What's happening is the computer's reading the pressure in Robin's mouth underneath the gum tissue, and it's dispersing the fluid very slowly, very efficiently at a constant rate.
The wand's needle is smaller than traditional syringes, so the anesthetic goes in slowly over about 5 to 10 minutes, avoiding that sudden buildup of fluid in the gums.
Because of that, the nerve endings don't fire as much. You have a much more comfortable injection. Secondarily, it has forced the dentist, myself and all the other dentists using this technology, to slow down.
Robin Gurin isn't exactly a fan of needles, but she likes what she feels, or really, what she doesn't feel.
I couldn't tell anything was really happening except for like the initial little teeny prick. But I've had like paper cuts that felt worse than that did.
So we've nixed the needle. What next?
I hate the sound of the drill.
Now, all we see is a little bit of stain there now. But it's that stained area that we're concerned about.
Bring in the laser. As Kristen Calais and Dr. Ronald Goldstein watch her cavity blown up 20 times its normal size on an intraoral camera monitor, the laser cuts away the decay in the tooth by blasting it with water molecules.
Could make an extremely precise cut, so you don't have to cut away large amounts of tooth structure.
The Millennium laser works best on new cavities and can't be used for things like old fillings or making crowns. The good news is that it causes little vibration and almost no pain, so you don't need Novocaine.
I really didn't feel anything. Most of what I could feel is the water that he was using with the laser.
It's best for kids, of course, who have not had the misfortune of having to use a handpiece or burr or something that creates friction and heat and vibration. So it's really good for kids or even adults who have fear of a drill.
This type of laser can be used on cavities or for gum procedures too. And so far the patients seem to like it.
Just looked like that he was drilling away the dark color in the tooth, but feeling no pain at the same time.
Because this technology is relatively new, you may have to shop around to find dentists with things like the wand and lasers, but the extra work could take the pain out of opening wide. The laser's hydrokinetic cutting does not transmit heat or vibration, and the cut is usually very precise and conservative, so your dentist can usually save as much of the healthy tooth as possible. And sometimes a drill can cause tiny fractures in the enamel that can mean problems later on. The laser does not seem to do that.
All right, now, as far as cost is concerned, does it cost patients more to do this or
Well,
not?
that piece of laser that we showed you cost $50,000 for the dentist, so that gives you an idea of how expensive it is, but they say they do not charge extra to use it. You know, they don't pass that on to their patients.
Interesting.
So you really have to shop around.
And if you've spent